Good morning, good afternoon, and good evening. Welcome to Day 2, the 2020 HIRA International Symposium and Training Course. My name is Dr. Gidong Park. I'm the World Health Organization, WHO representative in Vietnam. I will tell you COVID-19 situation in Vietnam and the country's response to control COVID-19. Let me first tell you a snapshot of the Vietnam with this slide. Vietnam is a country at the east coastal area of the Indochina Peninsula. It shares border with China, Lao People's Democratic Republic, and Cambodia. It has a large population, about 97 million in 2019. It is an aging society with 12.3% of population over 60 years old. It is a developing country with lower middle income status economy. GDP per capita in 2019 was about $2,700 US. Its economy is rapidly growing. In 2018, it achieved 7.05% GDP growth rate. Now let's move to COVID-19 situation in Vietnam. As of 16 October 2020, the country has reported a total of 1,124 laboratory confirmed cases with 35 deaths. Of these, 1,030 cases, which is 92% of the all confirmed cases, have been recovered already. There are only 56 active cases under treatment. This map shows the number of the cases and deaths per localities. A city at the central coastal region of Vietnam, Da Nang, has recorded 394 cases with 31 deaths, the highest number among 63 provinces. Following Da Nang, other provinces following Da Nang is Hanoi, 163 cases with 0 deaths, and Quang Nam province near to Da Nang with 102 cases with 3 deaths, and Ho Chi Minh City, the largest city in south of Vietnam, with 79 cases and 0 deaths. When we consider the population size and the number of the confirmed cases per million is 12, and the number of deaths per million is 0.4. These are quite impressive interim results, considering the context of the country near to China, with land crossing border, large population, with aging society, and developing country with lower middle income status. I'll tell you later factors contributing this success. Before that, let me tell you further on COVID-19 situation in Vietnam. Regarding gender distribution, there are no big difference between female and male. Regarding age distribution, young adults between 20 to 39 years old are most affected group. This figure is the epidemic curve in Vietnam. Red bars represent locally transmitted cases, blue bar represents imported cases, and then yellow bar represents deaths. COVID-19 situation in Vietnam can be divided into 5 periods. Period 1 is from late January till early March. The country's first case was reported on 23rd January. The first case was a Chinese living in Vietnam, returned from Wuhan, China. You will see small number of the cases until mid-February during the period 1. Period 2 is from early March till late April. It began with unimported cases. A Vietnamese returning to Hanoi after traveling to several countries in Europe in late February, including United Kingdom, France, and Italy. You will notice outbreak curves with a peak about 20 cases per day in late March. Period 3 is from late April to late July. During this period, country reported only imported cases. All of the imported cases were detected during the mandatory quarantine of the 14 days upon arrival. Period 4 is from late July to early September. It began with locally transmitted cases reported from Da Nang, who has no travel history, no clear epidemiological linkage with any imported cases. You will see high curve in more than 80 cases per day in early August. Period 5 is from early September till now. Again, countries are reporting no local community transmission cases and then only imported cases. From this slide, I will tell you about the factors contributing Vietnam's success. I would say the first factor is early activation of the strong response system. I'll explain you further in detail how Vietnam activated their response system early and then how strong their response system was, using some slides and some stories from country's response in January and February. While the COVID-19 first cases in Vietnam was reported on 23rd January, the country has activated its response system since early January 2020. Late December 2019, there was first reports on severe pneumonia with unknown etiology from Wuhan, China. Vietnam conducted its first risk assessment exercise in the first week of January 2020. On 13th of January, Thailand reported first case of this disease outside China, imported from Wuhan, China. Vietnam then convened its first multi-ministerial National Steering Committee on Prevention and Control of the COVID-19, chaired by the Deputy Prime Minister. On 20th of January, the government issued the first version of the National Response Plan on COVID-19, which has been updated several times since then. On 23rd of January, country reported the first case, and Wuhan city in China was locked down. The government of Vietnam ordered to extend Tet, Vietnamese Lunar New Year, Tet school holiday, to prevent school outbreaks of this new disease. On 30th January, WHO declared this disease outbreak as public health emergency of the international concern. The Vietnam then established the National Steering Committee formally by decree of the Prime Minister. As the report of the new confirmed cases imported from China continued, the country denied, the Vietnam denied of the entrance of the travelers coming from China. And on 7th of February, the Ministry of Health convened its first nationwide online training on how to detect, test, and treat this disease. All the public hospitals and the health authorities from 60 provinces were connected to Ministry of Health by virtual platform. Country's COVID-19 response in February and January reached its peak with so-called Son-Loi quarantine. I tell you further on this with next slide. Son-Loi is the name of the small commune with 11,000 population at Vinh Phuc province near Hanoi. On 17th of January 2020, a group of the workers came back to Vietnam after finishing training workshop conducted in Wuhan, China. Some of them developed the symptoms from 21st of January. And total of the 6 workers were confirmed as COVID-19 cases, COVID-19 patients between 30th January and then 7th of February. Of these, 3 cases were from same commune, Sonroi commune. The country was able to prevent further spread of this virus from these cases except one. One case triggered 5 second-generation cases and then 1 third-generation cases. All were reported from the commune, Sonroi commune, that we call this Sonroi cluster. The National Steering Committee applied very strong measures to control this cluster. All the cases and suspects were isolated at the hospital, and then strict infection prevention measures were applied. In addition to this, a commune-level quarantine measures were applied to Sonroi commune for 3 weeks, from 13th of January until 3rd of March. All the movements coming in and then going out from this commune was strictly controlled. Affected people were about 11,000 people, 11,000 individuals. A rapid response team was deployed on the ground, and government provided essential life commodities to all commune people for free during quarantine periods. With that, Vietnam was able to control the first wave of the COVID-19 outbreak in country. Let's move to second factor contributing to Vietnam's success. I would name strong government leadership and successful mobilization of the resources using a whole-of-society approach. From the beginning of the country's response, the top government leaders committed themselves and then provided clear guidance. The Deputy Prime Minister, Mr. Budok Tam, the chair of the National Steering Committee, was at the front line. With his leadership, the National Steering Committee has been able to coordinate response activities from 14 ministries concerned. When any of the response measures requires decision by the head of government, the Prime Minister, Wen Sam-puk, made quick and firm decisions. I will explain you further in detail how the governments exercised strong leadership and then how they were able to mobilize resources through a whole-of-society approach in controlling COVID-19 outbreak, with example in the response in April and then July, August. The second wave of the COVID-19 in Vietnam began with unimported cases from Europe. It evolved into more complicated situation than first wave. Multiple imported cases from multiple countries, and then several community clusters linked to imported cases, and then a few cases without clear epidemiological linkage, etc. In the meantime, WHO characterized this outbreak as pandemic on 11th of March, and then in the middle of March, total number of the global cases, confirmed cases, exceed 500,000, and then late April, it went over 2 million. The country responded by a whole-of-society approach. There were response measures newly issued by government almost every day. Right after report of the new cases, after 3 weeks of the peacetime, the country introduced mandatory health declaration of the all incoming international travelers at point of entry. On the 22nd of March, the country halted entry of the international travelers among foreigners into Vietnam. The country further decided to stop arrival of the international flight. Finally, the government issued a nationwide 14 days social distancing commencing from 1st of April. These strong measures were possible because of the strong government leadership. Let's move to stories from July-August outbreak. On 25th of July, the country confirmed a new COVID-19 cases of the community transmission The case was a 57 years old male living in Da Nang with no travel history, with no epidemiological linkage with any imported cases. He was detected by a routine surveillance system, so-called SVP, Severe Viral Pneumonia Surveillance System, at the hospital in Da Nang. This ended the peacetime of the 99 days with no community transmission in Vietnam. Newly confirmed case numbers sharply increased, and then over 14 provinces were also reported newly confirmed cases, and then no death case record in Vietnam was also broken. This graph shows the epidemiological curve of the community transmission cases only in Vietnam during July-August outbreak. The orange bar stands for Da Nang cases. Blue bar stands for cases from Quang province. These are two heavily affected localities by July-August outbreaks. Outbreak investigation team reveals there were undetected hospital COVID-19 infection clusters among hospital patients, family caregivers, visitors to these patients, and hospital workers in 3 major hospitals in Da Nang already from in early July. These include Da Nang General Hospital, Da Nang Sea Hospital, and Da Nang Orthopedic, and then Physical Rehabilitation Hospital. All these 3 hospitals are located in the central part of the Da Nang, same area, next to each other. Furthermore, Da Nang is a touristic hotspot, and July was a high season of the summer vacation in Vietnam, attracted huge travelers, millions of travelers coming from all corners of the country to Da Nang. These factors contributed to the complicated third COVID-19 outbreak wave in Vietnam. To control outbreak, Vietnam quickly mobilized all the necessary resources. These include surveillance system across the country was enhanced. National experts were deployed to the field, including outbreak investigation, laboratory, and then ICU doctors. Testing capacity was rapidly increased up to 10,000 tests per day in the field. And the field hospitals with capacity of the 1,000 beds was built in short time period. And then government applied the social distancing measures in selected areas. This infographic shows determination of the Vietnam and the level of the resource mobilization to control COVID-19 outbreak in Da Nang. Health workers with full personal protective equipment from all of the country deployed to Da Nang to assist outbreak control activities. With that, the country was able to control COVID-19 outbreak in 5 weeks. The third factor contributing to Vietnam's success was credible and then comprehensive communication. Throughout the whole period of the COVID-19 pandemic, risk communication team provided real-time update on outbreak situation, delivered communication product and messages through various means, including innovative channels such as mobile messenger, smartphone app, and YouTube video. Developed human history, human interest history, mainly featuring stories from the field, and countered rumors and disinformation. Let's watch a YouTube video promoting COVID-19 infection measures, infection prevention measures, and encouraging people's participation, encouraging people's compliance to the social distancing measures. This video was released in late March and hit over 8 million views so far.
Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Đang yên đang lành, cuộc sống đang tươi xanh thì bỗng có Covid. Dân ta lao đao rồi đi ra đi vào lòng lo lắng. Giờ sao bình tĩnh luôn giữ tay, vệ sinh kỹ khắp nơi ở quanh mình và giữ ý thức nhà vượt qua gian khó. Việt Nam ơi, đừng share chuyện sai trên Facebook, phải đeo khẩu trang cho đúng lúc. Đừng kỳ thị ai văn minh vì dân lánh mình. Kẻ thù nào ta không chiến thắng, triệu người ngày đêm đang cố gắng. Một vòng tay nối trọn Việt Nam, yêu thương cuộc đời, tin nơi con người. Đừng sợ nhé, chúng ta vượt qua hết. Đất nước của mình bao nhiêu ân tình, Việt Nam không bỏ lại ai phía sau. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Bình tĩnh luôn giữ tay, vệ sinh kỹ khắp nơi ở quanh mình và giữ ý thức nhà vượt qua gian khó. Việt Nam ơi, đừng share chuyện sai trên Facebook, phải đeo khẩu trang cho đúng lúc. Đừng kỳ thị ai văn minh vì dân lánh mình. Kẻ thù nào ta không chiến thắng, triệu người ngày đêm đang cố gắng. Một vòng tay nối trọn Việt Nam, yêu thương cuộc đời, tin nơi con người. Đừng sợ nhé, chúng ta vượt qua hết. Đất nước của mình bao nhiêu ân tình, Việt Nam không bỏ lại ai phía sau. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Đừng share chuyện sai trên Facebook, phải đeo khẩu trang cho đúng lúc. Đừng kỳ thị ai văn minh vì dân lánh mình. Kẻ thù nào ta không chiến thắng, triệu người ngày đêm đang cố gắng. Một vòng tay nối trọn Việt Nam, yêu thương cuộc đời, tin nơi con người. Đừng sợ nhé, chúng ta vượt qua hết. Đất nước của mình bao nhiêu ân tình, niềm tin nơi một Việt Nam sáng tươi. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Đừng share chuyện sai trên Facebook, phải đeo khẩu trang cho đúng lúc. Đừng kỳ thị ai văn minh vì dân lánh mình. Kẻ thù nào ta không chiến thắng, triệu người ngày đêm đang cố gắng. Một vòng tay nối trọn Việt Nam, yêu thương cuộc đời, tin nơi con người. Đừng sợ nhé, chúng ta vượt qua hết. Đất nước của mình bao nhiêu ân tình, niềm tin nơi một Việt Nam sáng tươi. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona. Việt Nam ơi, Việt Nam ơi, cùng đoàn kết đánh bay Corona.
So far, I have explained you a brief summary of the COVID-19 situation in Vietnam and then factors contributing Vietnam's success. Let me now tell you the role of WHO in COVID-19 control in Vietnam. WHO acted as a policy and then technical advisor at high level. As the WHO representative in Vietnam, I met leaders of governments of Vietnam several times and then provided necessary advice to them. WHO is the lead agency in health, in UN system, and then as well as other international development partners. We, WHO, facilitated technical support of these partners in Vietnam to control COVID-19 outbreak. WHO team has been working hand in hand with national counterparts since the beginning of the COVID-19 outbreak in January. Vietnam has not only controlled the disease outbreak within the country, but also has worked beyond the border to promote international and regional solidarity and cooperation to respond to COVID-19. Vietnam is currently the chair of the ASEAN, and it has advocated cohesive and responsive ASEAN. Vietnam convened the special summit of the ASEAN plus 3 countries on COVID-19, which urged ASEAN members and the 3 countries to unite and then to act decisively in response to COVID-19. Vietnam, throughout the Ministry of Foreign Affairs, also donated funds to WHO to support WHO global COVID-19 response, and as well as bilateral support to other countries. COVID-19 pandemic is a health crisis. It is also a socio-economic crisis. COVID-19 outbreak and its response has affected Vietnam's economy in several ways. This graph shows the decline in GDP growth in Vietnam. Vietnam has achieved high GDP growth during last decade. It was 7.05% in 2018, and then 6.77% in 2019. However, in the first 6 months of 2020, the GDP growth rate in Vietnam has dropped to 1.81% only. COVID-19 pandemic also produced a negative impact on Vietnam's domestic job market, as 31.8 million workers lost their jobs and then were forced to alternative leave and then income reduction. I will now conclude my presentation on COVID-19 situation and response in Vietnam with 3 take-home messages. First, Vietnam has been successful in controlling COVID-19 outbreak so far. Second, COVID-19 outbreak is still complicated globally, and Vietnam remains vigilant. Third, Vietnam is moving forward to safe coexistence with COVID-19 in a controlled manner. With that, I hope Vietnam could save lives of Vietnamese people, both from COVID-19 and negative socio-economic impact of the COVID-19 outbreaks. I also hope all the countries in the world could save life of their people, both from COVID-19 and negative socio-economic impact of the COVID-19 by balanced action on disease control and then socio-economic activity management. Thank you.